this very day, as soon as we're done. So whether you're having your lunch or a meal or incorporating the new recipe from Chef Kenny James to learn how food can be such a crucial role for supporting both pain and inflammation. So a real quick introduction. Thank you, Iris, for introducing me. So I am a naturopathic physician here in Oregon. I'm actually at my clinic in between patients today. So I work here as a primary care provider. So I see kiddos to older patients and manage anything from ear infections to cardiovascular to Parkinson's. I'm also a certified nutrition specialist, and that's just to say nutrition is one of my favorite tools to utilize. So whether I'm helping with managing symptoms or managing a condition or supporting optimized health, it's a favorite tool that I utilize, and I ask all my patients about what they're eating, and we talk about ways that it can be used in a strategic way to support their health in whatever way meets their needs. And yes, I've been partnering with the Brian Grant Foundation. I think it's 9 years now. So I've been at several fundraising events. I have contributed to different blog articles and a couple cooking classes. And I've really loved doing this series where we can really, I get to bring a lot of evidence-based research information, and then in collaboration with Chef Kenny James, come up with an option for you to consider and really bringing this concept of food as medicine into your very home. So a little bit, this is just, those are the 6 principles of naturopathic medicine if you're not familiar. So it just tells you a little bit more of the lens that I'll be speaking from. To Be Well is the clinic I work at as a primary care provider here in Portland, and natural sports medicine is my own business. And that's just to say that I offer virtual consultations under that umbrella. So I work with a lot of youth athletes up to everyday athletes. And again, the Parkinson's connection for me is I have a family member with Parkinson's. I also did a postdoc research fellowship in the area of Parkinson's with nutrition. And Brian Grant Foundation has been just the perfect fit for me because of my passion for nutrition, exercise, and mindfulness. Is just a great way to both contribute, learn, and participate in a way to support those living with Parkinson's. So let's get into what we'll be talking about today. And so I'm tried to keep it a little bit organized and logical. Pain is a rabbit hole of information, but I'm hoping to just explain a little bit of understanding what pain is, how we currently understand it, a little bit more of pain and as it relates to Parkinson's disease. And then we're going to really dive into how nutrition can play a role with managing pain, and along with botanical medicine, which is sort of the herbal medicine and culinary herbs play a role. And then we'll finish with hopefully enough time to answer a lot of your questions today. So to start, this is what was previously understood when we talk about pain. This was sort of that there's a stimulus. So whether it's the kind of the stereotypical examples are like stepping on a nail or touching a hot stove, and just sort of that reflex of experiencing pain. There's a stimulus that then the brain perceives as pain, and then there's usually like a reaction, and hopefully then there's a healing process and a resolution to that. Our understanding, though, has really changed over the past several years, and the field of pain and perception of pain and the experience of it has been really shifting into what we now identify as this biopsychosocial. These are all components that can contribute to the experience of pain. And so maybe this is a new concept, and it's just to say that these are some other things that you can think about when you think of more of a comprehensive or holistic approach to pain management. These are some areas that can be considered. And some examples that make this a little bit more relevant are the severity of pain doesn't always match damage to tissue. So one example I think about is a paper cut, right? So that's something that can be really painful. It can be tender for quite some time, but really the damage to tissue is pretty minimal. Or we think about when it's more long-term pain, so for example, after a car accident, maybe someone had whiplash or they hit their shoulder, but maybe 10 years later, even though the tissue is no longer damaged, they still may be experiencing some sort of remnants of sort of residual pain or discomfort in that area. And so it's a lot more expansive than just, that stepping on a nail or touching a hot stove. There's a lot more context to understanding pain and how that is experienced. As a clinician, when I'm working with patients, this gives you a little insight. This is inside scoop here. One of the ways that we organize understanding someone that is concerned about pain is this acronym called LOCUSMAT. And what that stands for is the location, understanding onset. So location, so sometimes someone will say, oh, my shoulder hurts. But then I really need to, can you point to it? So do you think this is your shoulder? Is it here? Is it back here? Or your hip, is it in the front? Is it side? Is it actually your low back? Onset has to do with, was this 2 weeks ago? Was this 2 years ago? Quality, and this is where it gets really interesting. I'm curious if maybe you want to chat in there too. That's when we describe pain. And that can be something that a lot of my patients, it can be challenging. So often my word bank is usually, is it dull and achy? Is it sharp and shooting? Is it zingy? Is it throbbing? Does it feel hot? Does it feel, and sometimes patients will describe it in unique ways, but that's the quality of the pain, and that can help identify really the cause of it. Severity. So on the bottom, you'll see, you might have seen this pain scale before. You might have been asked it before, on a scale of 0 to 10, 10 being the worst pain, how would you rate your pain? And sometimes there's other scales or metrics that are utilized to understand sort of what is this person experiencing, or how can we better understand to treat and support this individual. Modality, so those are, what are things that make it better? What are things that make it worse? And so that could be when I'm walking upstairs, it's worse. When I'm sitting for a long time, it's worse. When I do this, it's worse. Maybe it's when I use heat, it feels better. When I stretch, it feels better. All of these point to a little bit more of the source of the pain. And that's also then what alleviates it. So what makes it better or worse? And then timing. Is it worse in the morning? Is it worse by end of day? These are all things that can be really helpful. And what's interesting, we'll dive a little bit into this acute versus chronic. So chronic is really defined as after three months time. And so sometimes things are acute, meaning they happen and it's a flare up and they develop into chronic. And sometimes it can be a little bit more insidious. And so this is something just to have, maybe it's, my hope is by sharing some of this information, it can give you a little bit more language when you're communicating that with either a physical therapist, a provider, an occupational therapist, or even a neurologist around what you're experiencing to better be supported with a treatment or support. So that is a little bit more of understanding pain. The next concept I wanted to share is really that it is also really, it's a multiple system. So we are so interconnected as a human body, your mind, your immune system, your brain, your stress status, all of these things are so interconnected. And what we're going to be really highlighting today is pain in the immune system, specifically inflammation. And so we'll be diving into that a little bit more as we go on. So this is just a little bit of an example. Again, I'm a visual learner, so I like these kind of graphics. If it's overwhelming, or if it triggers like 8th grade biology or something, then you don't need to completely understand it. But on the left here is really just an understanding of an acute. So this is maybe injury or an infection, inflammation, and then healing. So inflammation is necessary. It's part of a healing process, and the resolution of acute inflammation is appropriate. Where it becomes problematic is when you have ongoing inflammation. So we call that sometimes people call it subclinical or low grade, and chronic for a long period of time. And this type of inflammation is when we can have, there's even other diseases that are being associated with this type of low-grade inflammation. Even things like high blood pressure can be a part of that. So This is just to give you a little bit of sort of concept of understanding in an appropriate framework for inflammation being a healthy thing, a necessary thing, but its resolution is really important. And then we're going to learn a little bit more and discuss how there can be triggers for inflammation in a way that isn't serving you, and how we can sort of disrupt that cycle in a way to support pain management. Okay, so this is also something you might want to consider if you want to just understand the inflammation status of your body. And so this is blood work considerations. A lot of the research that you'll find, if you dig into any studies, is a C-reactive protein, and I'm going to be highlighting that throughout the rest of the presentation. This ESR is sed rate. Ferritin is also an inflammatory marker, white blood cells, other pro-inflammatory cytokines. And as we talk a little bit later, there's these different essential fatty acids, and the omega-6 are inflammatory, omega-3 are anti-inflammatory, and you can actually do a blood test to check the ratios to get a better understanding of an inflammation status. So that's also for you just to consider, or maybe if you've had blood work, you can reference it and kind of get an idea of where you're currently at, and maybe by incorporating some of these strategies I'll be sharing, hopefully you can see that those numbers improve. Okay, so a little bit of inflammation, a little bit of pain, and how are these now connected? So again, CRP is that C-reactive protein, and what we've been able to identify is there's a strong correlation with individuals that have an elevated level of CRP and having low back pain. And not only is it that they're associated, but it's also the intensity of the pain that's reported. And then when we talk about pain interference, that has to do with other things that someone might be experiencing because of the pain. And so that can be things like depression, fatigue, or even mood or sleep disturbances. So those are some other things to be considering. So here we are, I'm just trying to connect all the dots in this story that we're understanding of pain, inflammation, and then as we discuss a little bit more as it relates to Parkinson's. So within pain, again, it's a giant topic, and within Parkinson's, then there are going to be different types of pain that can be experienced. And what we're going to be highlighting today is going to be the musculoskeletal. There's also, just for you to be sort of familiar with again, or have language, or to invite conversation with a neurologist, is understanding that there can also be peripheral pain. So that's going to mean anything in your extremities, so hands and feet. And then also dystonic and akathisia. And these are some specific treatment options that are associated with those pain types. So conventional treatment often is going to be different types of medication. What I want to highlight is those first three are actually support lowering inflammation. So that's to say, if those have been helpful for you potentially in the past to take an NSAID, or take acetaminophen, then that's probable that incorporating some of these anti-inflammatory strategies can also be a helpful and perhaps better option. So interestingly, a lot of times with pain management, there's often antidepressants that are also recommended or prescribed. And so that also speaks to, again, that multi-system approach. And sometimes that can be beneficial, but sometimes it can be just sort of throwing pharmaceuticals to see what sticks, to see what can be beneficial. So what I want to offer or invite you to consider are a few other additional options when it comes to treatments, and that's complementary, integrative. As a naturopathic physician, I'm able to use both. So I do use pharmaceuticals, but I often like to start with less invasive or less negative side effect options. I'm not going to be speaking a lot to any of these physical modalities like massage therapy, acupuncture, and such, but I will highlight that in a lot of the research I was finding, massage therapy was identified as being one of the most beneficial for those experiencing musculoskeletal pain, those Parkinson's patients that experience musculoskeletal pain, but it was temporary. There's also a lot of research for acupuncture being really beneficial as well. And we're going to dive into now the medical nutrition and botanical medicine. So hope I'm Hope everyone's staying with me. If I'm going too fast, let me know. Maybe Iris or Nicole can slow me down, but hopefully you're seeing this connection and connecting the dots as we continue. So within pain as it relates now to Parkinson's, so musculoskeletal is again we're going to be highlighting, and that is actually the most common pain presentation for Parkinson's. These are some of the sort of etiology or causes that are considered when how it influences musculoskeletal pain. So it can be because of postural changes or different muscular rigidity, frozen shoulder. So that if you've ever experienced it, that gets also called adhesive capsulitis. I've also seen that clinically with blood sugar dysregulation or thyroid issues. So there can be a lot of different reasons why that shoulder can just become really painful or immobile. Again, the low back pain and osteoporosis. So these are some of the contributing factors to musculoskeletal pain for those with Parkinson's. And again, it is one of the most common non-motor symptoms reported up to 90% of patients. And the reason why I think that's important to share is that if this is something that you're currently experiencing, you are not alone. And I hope that that can be somewhat comforting. And I'm hoping that maybe even the conversation today as a collection can offer encouragement or insights or options to support you in an even better way. So now let's bring it to nutrition. Let's bring nutrition into this conversation around pain and inflammation. So this is a really helpful sort of cycle that we see. SAD, I'll be explaining a little bit more, but that stands for the Standard American Diet. And it's often joked about the fact that, yes, it is sad. But when we see this type of sort of an average American diet, we see that it can lead to this inflammation, which can lead to different types of deficiencies. It can lead to obesity, microbiome changes, for those of you that were able to attend to the gut talk, where we talked all about the microbiome. But that can also lead to an increase in pain. And that then changes activity, function, mood, which then again will influence food choices, which often is just sort of kind of creates this vicious cycle where there's really not any healing happening or resolution of some of those root causes that are contributing to some of the pain that's being experienced. So a little bit more about the Standard American Diet. What we'll see, so it's usually low fruits and vegetables, which means low fiber. The probiotics are the good gut bugs. And so that has to do with how you are, whether it's yogurt or fermented foods, highly processed. So that means when you're taking foods and it's just being sort of diluted or processed in a way that it's, powdered and formed and then recreated. So the nutrient density of the food is really lost. Additives, so that's those sugars and salts, inflammatory fats, a lot of liquid calories. So those are things like soda pop, and even the mindless, both the preparation or consumption. So whether that means just eating in a car or watching TV and just sort of eating food, what we've been learning more and more is how mindfulness can also support how you're able to eat and absorb food. So I'm really excited about the mindfulness party that Iris has mentioned that's happening later this month, as well as learning more about mindfulness is such an important component, and I'll be interested to see how that can inform even how it relates to nutrition and diet, and support overall health in that way. So when we think about that, now we learn how this diet is also then it can exacerbate body pain. So some of the things that can be connected to is this chronic low-grade inflammation. So when you're not getting a lot of fiber, when you're getting a lot of sugars, when you're getting a lot of processed food and additives, then this can create all of the mood disorders, body pain, again, we're highlighting, weight changes and infections, things even like dementia or even a higher risk of diabetes. So we see all this sort of trending towards negative health. And what studies have shown is that when individuals are on a standard American diet, it actually can worsen chronic pain. And so how it does that is nociception is actually like your pain receptors. And so it can change the sensitivity of them. this overall inflammation, and then also the persistence of pain. So sort of the experience of ongoing pain. So nothing good so far, nothing good here. And then also understanding how especially really high sugar, again, is going to be that chronic inflammation, and going back to some of those inflammatory markers we talked about early on. So whether it's the C-reactive protein or SED rate, we're seeing that people with high diets, with high sugar diets rather, are also having some of those higher inflammatory markers. So these are all these connections here. And lastly, just understanding that those with chronic pain actually have less of a diversity in the microbiome. So my last presentation, we were talking about the goal is to have a lot of fruits and vegetables, a lot of probiotics, and you want to really think about growing a rainforest. And so you want as much diversity as possible. That creates the most health. We're seeing a lot of correlation to diversity being the key to gut health, and how that can actually then play a role with pain. So very interesting. Everything is so interconnected here. So let's change. Let's see if we can talk about a little bit more the positive way of how to utilize food. So rather than just seeing how it can be this low-grade inflammation and contributing to chronic pain, what's exciting about food is it can empower you to think about how you can support your body in a way of both lowering inflammation and lowering pain. So this is Hippocrates. If you've heard of him, he's the father of medicine, we identify as. And so this is his quote of "Let food be thy medicine and thy medicine be thy food." And so this might be something you've heard before. While it seems like, oh, that's, back then that might have been more applicable. This is from August of 2020. Now, Harvard Medical School is even learning that the best way to reduce inflammation has to do with foods and nutrition. And so this is referencing the idea of not just your medicine cabinet, but actually your refrigerator being a great way to fight inflammation. So what are those foods, right? Let's get to it. So nutrition, I want to talk a little bit about how it can modulate, influence pain. And so we can think about nutrition. So I talk about food as medicine. You can think about nutrition as pain medicine, or a strategy for managing pain. And so this is going to impact levels of inflammation, different levels of receptors, neurotransmitters, hormones, different systems. And the last one is also important because what we're finding, especially in other conditions, is that as you are lowering inflammation or managing pain, it might also decrease need for other medications. So most specifically around pain management. So that is both exciting and also good to have on your radar. So the diet that I would say, as far as sort of like a dietary pattern to consider and guidelines to consider, would be the anti-inflammatory diet, which is very similar and consistent with the Mediterranean diet. And that's also what the Brian Grant Foundation recommends. And so for additional resources, again, for recipes and insights, you can check out their website to make sure you have all the tools you need. But anti-inflammatory diet is really where you're going to look to undo all that the standard American diet is doing in a negative way, to then use these foods to really support health. So some of the top 10 anti-inflammatory foods are going to be, again, these green leafy vegetables. And oftentimes people might be familiar with spinach or lettuce, but I encourage you to expand what you're familiar with, but maybe trying, especially this summer, as leafy greens are, again, coming to the farmers markets or more readily available, are going to be things like mustard green, collard greens, Swiss chard, arugula, and various other leafy green vegetables. Blueberries, so that's what's in the golden blueberry crisp for this time around with Chef Kenny James. So blueberries are really great, and one of the things you can take away is anything that's going to be very colorful, especially these blues and purples. Those are different types of anthocyanins and polyphenols, we call them, but really just thinking about eating a variety of colors. Salmon is a great source of omega-3s, and so this is other fatty fish would be tuna, and then things like broccoli, again, would be super helpful. And these are some other herbs and spices, so ginger and turmeric, and again, that's part of the recipe this time around, along with chia seeds. Pineapple, garlic. So as best you can incorporate some of these anti-inflammatory foods, you're going to be able to support that, like the consequences of inflammation in the body. So these are some great top 10 foods to fill your pantry with or your refrigerator with. One thing that's really interesting to think about is we've also been able to associate specific nutrients and nutrient deficiencies, meaning you're not getting enough of them, with pain. And so these are nutrients that are associated with pain management. So your B vitamins, CoQ10, vitamin D, folate, calcium, amino acids, which is from various protein sources, omega-3s are what I would highlight, along with zinc. We're learning more and more about how these play a role in the perception of pain. Sometimes they have to do with the inflammation. So if you don't have enough of these, they're not able to sort of put out the fires of inflammation. So now a little bit more specific. So some of the correlations are with specific nutrients, again, to that inflammatory C-reactive protein. So one mineral I would highlight is magnesium. Most people are deficient, meaning they don't get enough of it. And studies have revealed that 19% of at least US adults are not, they're getting only half of the recommended daily allowance, the RDA. We're also seeing that any adults that are consuming less than the amount that they should are actually having that elevated CRP levels. So we're seeing this seesaw of low magnesium ends up having higher inflammatory markers. So it's just another good connection to be making. And specifically within pain management, we're seeing a lot of this. Migraines was one of the studies that show that basically a deficiency in magnesium was correlated to more migraines, more inflammation, and this statistic of, so migraines increased 35.3 fold when magnesium was just below normal level. So this is a great way to think about this mineral, incorporating foods that have high magnesium as a way to support pain. Some of the top food sources here that you can think about would be pumpkin, almonds, again, those leafy greens, cashews, dark chocolate, so that's great, and that's in there, and avocados. So sometimes it can be those healthy fats. But I also think about, when I see a mix like this, I was just thinking what a great even like DIY trail mix that you could have for the summer. So whether you're going to be traveling at all, or if you're going outside or a picnic, or anytime you just need a go-to snack, this would be a great option of throwing these things together to then know you're having a magnesium-rich trail mix to support pain management. So these are just hopefully, again, giving you some ideas of how to incorporate foods for yourself. So the next topic, this is a little bit of a tangent because botanical medicine means utilizing plants as medicine. And sometimes we can use it topically as it relates to pain, so on top of the skin. And these are just a few that I wanted to highlight. Lots of times botanical medicine is herbs that you use within your food, and some of these are both used for cooking as well as topically. So capsaicin is actually from peppers, some cayenne. And there's a lot of products on the market, especially for arthritis. I think it's like capsaicin is something I've seen over the counter that a lot of patients have used, but that's actually supportive for pain management. Castor oil can be used for pain management. It's often used also for lymph support. Arnica can also be utilized. And Epsom salts, one of the reasons why Epsom salts and salt baths can be supportive is because you can absorb some of the magnesium that's in the salt through your skin. So that's one of the ways it's actually effective for musculoskeletal pain. There's other things that can be helpful, so like lavender, chamomile, and peppermint, all of these can be supportive for pain. And then contrast soaks is really the idea of just using hydrotherapy or water of hot and cold. And so that can be something that can be supportive if you are having wrist pain or your ankles are bothering you, is to set in hot water for a couple minutes and then cold, and to go back and forth. And that can be really both soothing for pain. It helps with blood flow, lymph flow, and nourishing the tissue in that way.